Welcome back to our channel. In today's video, we will be delving into the history, impact, and current efforts to eradicate poliomyelitis, commonly known as polio. So, let's get started. What is poliomyelitis? Poliomyelitis is a highly infectious viral disease caused by the poliovirus. It primarily affects children under the age of 5 but can also affect older individuals. Polio spreads through contaminated food, water, and direct contact with an infected person. The virus attacks the nervous system, leading to paralysis, muscle weakness, and even death in severe cases. History of polio. Polio has a long and complex history. The disease has been present for thousands of years, with evidence of its existence found in ancient Egyptian and Indian artifacts. In the early 20th century, polio outbreaks became more frequent and widespread. The disease primarily affected children, causing paralysis and even death. In 1955, a major breakthrough occurred with the development of the first successful polio vaccine by Dr. Jonas Salk. This vaccine, known as the inactivated polio vaccine, IPV. It was followed by the oral polio vaccine, OPV, developed by Dr. Albert Sabin in 1961. The introduction of these vaccines marked a turning point in the fight against polio. Vaccination campaigns were initiated worldwide, leading to a significant reduction in the number of polio cases. The efforts intensified with the establishment of the Global Polio Eradication Initiative, GPEI, in 1988, a partnership between international organizations and governments aimed at eradicating polio. Since then, tremendous progress has been made. The number of polio cases has dropped by over 99% globally, and several regions have been certified as polio-free. However, challenges remain in reaching remote populations, and in some countries, the disease continues to persist. Structure of poliovirus. The poliovirus is a small, single-stranded RNA virus that belongs to the family Picornaviridae. The poliovirus is composed of a protein shell, known as the capsid, which protects the viral genetic material. The capsid is made up of 60 copies each of 4 different proteins: VP1, VP2, VP3, and VP4. At the center of the virus particle is the viral genome, which consists of a single-stranded RNA molecule which carries the genetic information required for the virus to replicate. The poliovirus has 3 distinct serotypes, designated as types 1, 2, and 3. Although all the serotypes are similar in structure, they differ in their antigenic properties, which affect the immune response and vaccine development. How poliovirus transmits. The poliovirus primarily transmits through contact with infected feces or contaminated water and food. Transmission of the poliovirus include person-to-person contact. Direct contact with an infected person's saliva, nasal secretions, or feces can transmit the poliovirus. This can occur through activities like shaking hands, sharing utensils, or changing diapers. Contaminated water and food. If water sources or food items are contaminated with the virus, and individuals consume them without proper hygiene measures, they can become infected. Fecal-oral transmission. The virus can be shed in the feces of infected individuals. If proper hygiene practices are not followed, after using the toilet, the virus can spread to others who come into contact with contaminated surfaces or objects. Respiratory droplets. While less common, the poliovirus can also spread through respiratory droplets from infected individuals while coughing or sneezing can release the virus into the air, and if someone nearby inhales these droplets, they can become infected. Pathogenicity of poliovirus. Pathogenicity of the poliovirus refers to the mechanisms through which it infects and damages the human body to cause disease. Pathogenicity of poliovirus include entry and replication. The poliovirus enters the body through the oral route. Poliovirus initially targets the cells lining the gastrointestinal tract, where it replicates and spreads to regional lymph nodes. From there, it can enter the bloodstream and reach other tissues, including the central nervous system. Neurotropism. The poliovirus exhibits a strong affinity for nerve tissue, particularly the motor neurons located in the spinal cord. It has the ability to cross the blood-brain barrier and enter the central nervous system, leading to infection and damage to the motor neurons. Destruction of motor neurons. Once the poliovirus reaches the motor neurons in the spinal cord, it begins to replicate and destroy these essential nerve cells. Motor neurons are responsible for transmitting signals from the brain to the muscles, controlling voluntary movement. The destruction of motor neurons leads to muscle weakness, paralysis, and, in severe cases, respiratory failure. What are the symptoms of poliomyelitis? The symptoms of polio can vary depending on the severity of the infection. Here are the different types of polio and their associated symptoms. Subclinical polio. Approximately 95% of polio infections are subclinical, meaning they do not cause any noticeable symptoms. People with subclinical polio may experience a mild, flu-like illness or no symptoms at all. However, these individuals can still shed the virus and potentially transmit it to others. Non-paralytic polio. Abortive polio. Non-paralytic polio accounts for about 4 to 8% of polio cases, and it is the most common form of polio and typically presents with flu-like symptoms such as fever, headache, sore throat, and gastrointestinal disturbances, which resolve within few days. Paralytic polio. Paralytic polio, on the other hand, occurs in a small percentage, less than 1% of cases, and involves the invasion of the central nervous system, resulting in muscle weakness, paralysis, and potential long-term disability, which may cause death also. Progression to paralysis. Muscle weakness or loss of muscle function, often affecting one or more limbs. Paralysis can range from mild to severe, and it can potentially affect the muscles involved in breathing, leading to respiratory distress and may cause death in severe cases. How to diagnose poliomyelitis? Here are the main methods used to diagnose polio, which include clinical evaluation. A healthcare professional will conduct a physical examination of the patient for any muscle weakness or paralytic symptoms. Laboratory testing. Laboratory tests are used to detect the presence of the poliovirus or its genetic material in various samples. These tests can include stool sample analysis. The poliovirus can be isolated from a stool sample during the acute phase of the infection. The sample is tested using viral culture or molecular techniques like PCR to detect the presence of the virus. Throat or throat washing sample analysis. In some cases, a sample from the back of the throat or throat washing may be collected to test for the presence of the poliovirus. Cerebrospinal fluid, CSF, analysis. If paralytic polio is suspected, a lumbar puncture, spinal tap, may be performed to collect a sample of the CSF for analysis. The presence of the poliovirus in the CSF confirms central nervous system involvement. What is treatment of polio? Currently, there is no specific antiviral treatment available to cure polio. However, supportive care and management strategies can help to manage symptoms. Symptom management. Medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, can help relieve fever, pain, and inflammation associated with polio. Physical therapy. Rehabilitation and physical therapy play a crucial role in managing the muscle weakness, paralysis, and physical disabilities caused by polio. Orthopedic devices. Depending on the extent of paralysis, orthopedic devices such as braces, canes, crutches, or wheelchairs may be prescribed to assist with mobility and prevent deformities. Respiratory support. In severe cases of paralytic polio that affect the muscles involved in breathing, respiratory support may be necessary. This can include the use of ventilators and ventilation devices. Pain management. Chronic pain may occur in individuals who have had polio. Pain management strategies, including medications, physical therapy and lifestyle modifications, which can improve quality of life. How to prevent polio? Here are the key strategies for preventing polio. Vaccination. Vaccination is the most effective method of preventing polio. Two types of vaccines are commonly used. Inactivated polio vaccine, IPV. IPV is an injectable vaccine that contains killed polio virus. It is given in a series of doses to infants and children. Oral polio vaccine, OPV. OPV is an oral vaccine that contains live but weakened polio virus. It is administered orally, usually as drops, and can be given during routine immunization or as part of mass vaccination campaigns. Achieving high vaccination coverage. To prevent polio outbreaks and ensure herd immunity, it is crucial to achieve high vaccination coverage in communities and populations, which includes routine immunization of infants and children as well as vaccination campaigns in areas at higher risk. Surveillance and containment. Maintaining strong surveillance systems is essential to detect and respond to polio cases promptly. Surveillance involves monitoring for acute flaccid paralysis, AFP, cases and testing for the poliovirus in stool samples. Safe water and sanitation practices. Improving access to safe drinking water, proper sanitation facilities, and promoting good hygiene practices, including hand washing, can help reduce the risk of polio transmission. Travel precautions. Travelers to polio-endemic or high-risk areas should ensure they are fully vaccinated before traveling. Additionally, some countries may require proof of polio vaccination for entry or exit. Conclusion. Polio has caused immense suffering, but we are closer than ever to eradicating this debilitating disease. Through vaccines, global initiatives, and community participation, we can make a polio-free world a reality. That's all for today's video. If you found this information valuable, please like, share, and subscribe to our channel. Together, let's spread awareness about polio and contribute to its eradication. Thank you for watching, and we'll see you in the next video.